By supporting the Flower Valley Conservation Trust, that's where we found goodness. Pick and Pay, always there for you.
Not only is September National Heart Awareness Month, it's also National Oral Health Month. And today we're talking about oral health with pharmacist Fransa Katz. And a lot of us do our utmost to avoid the dentist, but something we want to avoid even more is tooth and gum disease. Fransa, I've heard people saying that gum disease and tooth disease do result in overall, affects our health overall.
Health, yes.
Is that true?
Actually does. You know, by flossing and brushing daily, you get rid of the plaque that's on the teeth. But if you don't do that, the plaque will build up and bacteria live in the plaque. And that bacteria, if it's not removed from the mouth and it builds up to a lot of bacteria, it can start infecting the gums. And that is where you get inflamed gums and it's bleeding gums. And that is what we call gingivitis. But that is just in the mouth. But from that can progress and become a periodontal disease. And that is where it goes into the area around the tooth and actually to the bone. And that's where you lose your teeth. But the bacteria can then go into the bloodstream. And recent studies have actually shown that if you have periodontal disease, that will exacerbate stroke, heart attacks, and even respiratory disease. So there is a link between oral health care and general health and well-being of the body.
Well, it's so scary to think that if you don't take care of your mouth, it results in overall unhealth.
That you're not even aware that it can do that. But as I said, recent studies have actually shown the link between that.
So and vitally important to take
care. Yeah, because we always, I think, from childhood, it's about looking after your teeth to prevent cavities. And yes, that's very important. But it's not only to prevent cavities, it's to look after the soft tissue, the gums, every part of the mouth, and to prevent bacteria overgrowth in the mouth.
Now, a lot of people don't know, Fransa, and a lot of people do, but share with us, how do you prevent cavities?
Well, you have to brush twice a day, minimum twice a day, and floss once a day. And then there's also a lot of antibacterial and antiseptic mouthwashes available. You're supposed to also brush your tongue, because bacteria also lives on the tongue, and a lot of people don't find that very pleasant. So your mouthwashes actually is so convenient to just have. Don't use it to replace brushing teeth and flossing, but to add to it. Because the minute you've stopped brushing, within 5 minutes, the bacteria starts multiplying and growing again. So if you have a mouthwash, use that to get rid of the bacteria on the soft tissue in the mouth, on the tongue, and you can rinse during the day. If you've had lunch, you can have a rinse afterwards, and that way you can control the bacteria in the mouth.
Now, what about some other over-the-counter medicines or treatments that's available at a pharmacy?
Well, apart from your mouthwashes that you can discuss with your pharmacist, because there are different ones and depending on what the ingredient is. Other oral health care is there are quite a lot of creams available for sores that you can get in the mouth. Also, again, discuss that with your pharmacist. Any pharmacist will be able to advise you as to whatever is needed for good oral health care.
And when do we make that final knock on the dentist's door?
Most important, I think, when there's pain. The minute you have pain, go see your dentist. But also make sure to go see the dental hygienist twice a year, because she will then clear off excess plaque, keep the teeth clean, and can then advise and say, look, I think looks like there's a cavity somewhere, go see the dentist. So I would suggest go see her twice or him twice a year, your dental hygienist, and then once a year, your dentist.
Now, the nice thing about that advice is you don't actually have to go to the dentist. You can go straight to the oral hygienist, or straight to your pharmacist before knocking on the dentist's door.
Before having to repair once the damage has been done.
So rather precaution.
That's right.
And prevention. Fransa, thank you so much for joining us.
It's a pleasure.
We are back after the break here with Espresso on SABC3.